Okay, so the next patient has a mass in the left upper lip. It's been there for a while, and it's hard to differentiate if it is a cyst, a sebaceous cyst in there, or it is a mucocele on the inside on the mucosal surface. It got infected twice. I did aspiration twice. He has been on antibiotics 3 times, and it's time to take it out. The dilemma was there's no punctum. I can't see a punctum, and I cannot be sure. So I don't want to make a scar if I can avoid it, but I want to be able to remove it completely as well. So it's tricky. So I am going from the mucosal aspect on the inside and then just trying to dissect it out. And it's a little different approach, but I think it should work out because by palpation, it is pretty well defined. So let's get going. Okay, so we have a mass in the left upper lip right here, and doesn't show a punctum. It can be well hidden, but most of it is in the mucosal aspect right there. So when I palpate, I can almost see it. There we go, right there. The scar down from the repeated aspirations and drainages. So we need to go in this way and remove it carefully, preserving the nerve supply here from the superior alveolar nerve. So that's what we are going to do. Great. And then get it all out. Perfect. We'll show you the whole thing. So for this, we have to make a vertical incision, not horizontal, because with horizontal you can sever the nerve. It's more likely to happen, so definitely vertical incision and very, very careful dissection to avoid that, and the labial artery. So we'll show you in a second. Dab, please. Bovie, please. Dab, please. Aha, this is coming out already. Ah, interesting. Okay. Dab again, please. Perfect. It is a sebaceous cyst.
On the lip?
No, it's on the, yes, it comes on the lip skin.
Oh, wow.
That's it. All of this junk right here.
Oh, that's the side too that came on?
Yeah,
That's the side right here.
yeah. No, this is just the secretions.
Oh.
No, more. And more. And more. Oh, wow. Oh, geez, even more. Okay.
More cream cheese.
And I'm going to take this as well. And right there. Good, you can come out. Good. Good. Find scissors.
It's that right there.
Hmm?
That right there. You see? It's also like
Right, yeah.
there, yeah, where's that?
So now I'm gonna have you. Perfect. Right there is.
Wasn't sure if that's sac or something.
No, you found it. The scar tissue or sac. Either way is good.
Rubbing everything.
Yep, you got it.
Yeah. Nice.
Okay. A little more junk left. And there goes underneath here and there. Good. Okay, so let's go over the anatomy quickly, very quickly. So let's give you the fine one. So now here, so this is where the cyst was. We know it wasn't a mucocele. It was a sebaceous cyst. We couldn't find the punctum anywhere, but when we went in, we found the attachment. So let's go from the inside here. So here, when we look in there, this is your labial artery, and it's preserved. That's very important. This is the artery that during filler injections you don't want to inject into. This is your orbicularis oris muscle right here, and also on the top right there as well. So we had to split the muscle to get to this structure right there. And we had to go digging deep in there, right there, to remove all the tissue. So this is pretty big cavity in there. This whole thing is in there, right there. So that's deep, so we have to dissect all around there, very carefully preserving the artery right there. So now when I put this underneath, right here, you can see all over. And since we didn't cut the punctum and get the thing, we had to really scrape off the sac wall, the epithelium on the inside, very carefully, which we did. And looking in the deep hole there, there were no remnants. So now we can carefully stitch it and get done. That was it. So we were able to manage it. Perfect. Good. Only this one halfway. Good. Okay, so we are 1 week post-op from the cyst. It turned out to be a sebaceous cyst in the lip on the left side. And I was able to go from inside the lip, as you saw in the video. Wanted to show you what it looks like 1 week post-op. It looks pretty good, actually. So that's fantastic. And I don't think there's any numbness in the lip, correct?
I mean, it's just healing on the outside.
Right, but no, otherwise, so that's great, fantastic. So that's the biggest concern. But let's take a look inside now. So you can see from the outside looks good, and now we are going to go on the inside. Okay, there we are. So you can see the stitches. They're absorbable, they're almost gone, and it's healed really well. Very little induration, very little discomfort, and bye-bye cyst. And the lip, you can see, looks fantastic. And we were able to avoid a scar on the outside. And it definitely was coming from the left upper lip.